Henshaws, daily living.
Putting in eye drops.
Welcome to Henshaws Knowledge Village. Today we're at Manchester Royal Hospital and I've got Karen, who's a specialist glaucoma nurse, and she's going to tell me stuff I don't know and hopefully there's stuff that you don't know too. So Karen, tell us a little bit about yourself and what you do here.
I'm one of the glaucoma specialist nurses at Manchester Royal Eye Hospital. What we find with glaucoma is the first line of treatment is often eye drops, and we find that quite a few patients struggle with putting eye drops in. From a glaucoma point of view, we know that the intraocular pressure can have an effect on the optic nerve and the visual field, so affecting your vision. The drops are really important because they're prescribed to reduce the pressure. So if we're not using the drops, the pressure is going to come up and things are going to continue on. So it's really important that you use your drops as prescribed.
Okay.
So we just thought we'd do a bit of a video to try and make things a little bit clearer so that people feel a bit more knowledgeable about putting their eye drops in or finding different ways to make it easier.
And we found that videos help people to remember that what they've already been told, but it also helps the rest of the family as well. They can kind of go back to that video and it's really a good kind of resource to have. Mm-hmm. And as long as the treatment doesn't change, it's always there available for people.
Yeah.
So what are the best ways? What are the tips and tricks that you've got with regards to?
Okay, so the first thing you should always do before putting your eye drops in and afterwards as well is just make sure you wash your hands properly with soap and water. It helps prevent your risk of getting infections and things like that,
Yeah,
and especially if you've had surgery as well recently, so it's more important.
Yeah.
Most drops, or a lot of drops, have a 28-day life, so once you break the seal on the bottle, after 28 days it should be changed, right, even if there's some left in. Okay. So always make sure you get your repeat prescriptions in time if you're using them for glaucoma drops especially. And if you're going away, making sure that you plan that you've got your prescription in time so you're not running out and not having a few days where you've not got drops. Other thing as well is just making sure that you check your storage instructions. So pharmacists will usually advise you on that if they need to be kept in the fridge or anything like that. As well, if you're wearing contact lenses, always make sure you remove your contact lenses before putting your drops in, right, and then don't put them in for a good 15 minutes afterwards, just because it can damage the contact lenses if they've got preservatives and things in the drops. Okay. I'll demonstrate a few different ways of putting eye drops in. Okay. And also there are various drop dispensers available for different kinds of drops. So we can just demonstrate a couple of them as well.
Okay, so you got some tools with you?
Yes, so we've got just a little dummy eye drop bottle, which I can just show you the bog standard way of putting your eye drops in.
Okay.
So this is what we normally teach people. So of course I've washed my hands beforehand.
Yeah.
And you take one finger, pull down your lower lid, so you're creating a little pocket.
Okay.
And then head back, looking up to the ceiling, and then you would squeeze your drop just into the centre of that little pocket, and then release, let go, close your eye, and just press on the corner between your eye and your nose to help stop the drop flowing through that drainage network there. That helps minimise some of the side effects. Yeah.
And you can just close your eyes as well. Does that work equally as well?
Yeah, so lying down, eyes closed, and even just pressing on that for a few minutes, that can help as well.
So I saw that you use your other hand to kind of guide, because if somebody can't see too well, they can use that
so what we
as like a rest.
Yeah, so what we find sometimes is that when we watch patients put eye drops in, is that because they may be a little bit unsteady, sometimes you can use your other hand as a steady, and it gives you a bit of distance away from your eye, so the tip of the bottle isn't touching the eyelashes or the eye, because obviously that can cause a scratch, or it can again cause infections. So you pull your lid down and you can rest one hand on top of the other and just squeeze over your eye, so it's just not actually, it gives you a bit of distance away from your eye as well.
So I've got a little tip and trick about somebody that maybe can't look up or got a stiff neck.
Yeah, so
lie down?
Yeah, lying down is a good way of doing it as well, especially if someone's unsteady on the feet as well. So that's because once you tip your head back, your tendency is to kind of go backwards, you may fall over, so it's good to be sitting down or lying. And
it's probably good to practice as well, but not with your
not with your own drops, because you've run out quicker, but you could use something over the counter. You could check with your local pharmacist and see what you're able to use just as a practice with, that doesn't contraindicate just with your own drops.
Yeah. And just practice is perfect.
Yeah. Yeah, there's a few different ways that I wanted to show you that you can use your eye drops. So there's the steady in your hand as well. So whereas we were saying about stiff neck and lying down, another way you can use it is by always pull your lower lid down, so you can rest it on your eyebrow. If you're lying flat, you can just squeeze it that way. Yeah. Or you can use it on your eyebrow, lying back and squeeze that way. Yeah. There's another way you can use it. So put it upside down and rest your hand on your forehead, and then do it that way. Or you can do one-handed, so for people that might struggle with have an injury to their arm, or they've not got full use of their arm, hook your little finger, pull your lid down, and then just squeeze. So that's one-handed. And then of course you can use a mirror as well, just to look what you're doing, if you can see where you're putting your drop then. Okay. With the drop aids, this one's a fairly good one. It takes quite a lot of different drops, so this would fit in like that. Close it around it, put that over. The square cut out part is where you put your finger to pull down, and you rest that on your brow, and then squeeze the big buttons either side. Okay. And then we've also got.
So how do you decide which one is right for the patient?
I think it depends on what the problem is. So for some patients, they struggle with getting it in position over their eye. Okay. So this is a good, well, they're all good for that really, for getting it in position over their eye, and it keeps it steady because it's resting on your brow. Yeah. It's also good for if you've got problems with arthritis and difficulty squeezing your drops because they're quite small. Yes. The other one that's available that's quite a generic one as well that fits quite a few different things is just this one. So that one's like a bit like an eye bath. It's a little pinhole to look through. Okay. So you pull down and then squeeze, but always getting your head right back so that it goes in. Then there's ones for patients that need to use single unit dose drops. So that just slides in. Obviously that's got the lid on, I'm not going to take that off. Yeah. You pull down and there's the oval there that you can see through, so you pull down, head back and squeeze in. So it pushes against something hard, so it's able to squeeze out. I think that's it really with demonstrating some of the drops that I've got.
Thanks Karen, that was absolutely brilliant. There's going to be plenty more videos from this collaboration with Manchester Royal Hospital and Henshaws. So it's bye from me and it's bye from Karen. Bye.
Our videos are helping people across the world. If you found them useful, please donate on our website so we can keep making more videos like this in the future.
Henshaws, supporting people with sight loss and a range of other disabilities to go beyond expectations.